Imagine sipping your favorite dark roasted coffee without worrying about stains on your teeth. Sounds ideal, right? Well, an ordinary kitchen ingredient might just be your solution: baking soda. But before you reach for that box in your pantry, let's dive deep into how baking soda can affect your dental health. Is it a teeth-whitening miracle or an old wives' tale that could damage your enamel? Stay tuned as we explore the ins and outs of baking soda for oral care. Baking soda, or sodium bicarbonate, is a white crystalline powder that is naturally alkaline. Commonly used in baking as a leavening agent, it reacts with acidic components in recipes, releasing carbon dioxide and helping dough rise. Beyond the kitchen, baking soda is a versatile household staple used for cleaning, deodorizing, and yes, even oral hygiene due to its mild abrasive properties and alkalinity. Historically, baking soda has been a go-to remedy for oral care. Before the advent of modern toothpaste, many cultures relied on natural substances like baking soda to clean teeth and freshen breath. It was praised for its simplicity and effectiveness in removing plaque and whitening teeth naturally. Baking soda's mild abrasive nature helps it gently scrub away surface stains from your teeth, making it an effective whitening agent. Its alkaline properties also help neutralize the acidic environment in your mouth, which can prevent bacterial growth and combat bad breath. Baking soda is widely recognized for its ability to remove stains from the surface of the teeth, making them appear whiter. It's particularly effective against stains caused by coffee, tea, and smoking. However, its whitening power is limited to surface stains and does not affect deeper discoloration. Beyond teeth whitening, baking soda can improve overall oral health. It neutralizes harmful acids, helps kill bacteria, and freshens breath. However, it does not contain fluoride, which is essential for strengthening tooth enamel and preventing cavities. While regular toothpaste typically contains fluoride and other ingredients approved by dental health professionals to prevent cavities and enhance oral health, baking soda offers a natural alternative that can be less abrasive than some whitening toothpastes. However, it should not replace fluoride toothpaste for daily use. To safely use baking soda for oral care, sprinkle a small amount on your toothbrush and brush gently to avoid damaging the enamel. Alternatively, make a paste with water, which can be less abrasive. It's essential not to use baking soda too frequently, as it can wear away enamel over time. The abrasive nature of baking soda means it can gradually erode tooth enamel, especially if used improperly or too often. This can lead to increased tooth sensitivity and a higher risk for cavities. Most dentists agree that while baking soda can be an effective part of oral hygiene, it should be used cautiously and not as a substitute for regular toothpaste. It's best to consult with a dental professional before making it a regular part of your oral care routine. While baking soda is an affordable and effective way to help clean and whiten your teeth, it's not a magical solution and should be used with care. It offers a fantastic way to enhance oral hygiene occasionally, complementing your regular dental care routine. Remember, the key to a healthy smile isn't just about how you clean your teeth, but also about maintaining a balanced diet, regular dental checkups, and following professional advice. Baking soda can be part of your arsenal for a brighter smile, but it shouldn't be the only tool. Now, I want to hear from you. Have you tried using baking soda as part of your oral care routine? What was your experience? Share your stories in the comments below to help others learn from your experiences. If you found this video helpful, please like, share, and subscribe for more insightful content. Don't forget to hit the bell icon to stay updated on our latest posts. And if you're thinking about trying baking soda or any other natural remedies, consult with your dentist to ensure it's safe and suitable for your dental health needs. Let's keep our smiles bright and our teeth healthy together.